Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. Welcome to my home gym. I love to exercise and I love cosmetic surgery, and I love it when my patients exercise, but sometimes they don't go hand in hand. And we're going to do a little video today about exercise during your cosmetic surgery recovery. So I hope you get a kick out of this video. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. Thanks for watching, and I hope you subscribe to our channel. So, a little history if you've never seen our videos. I'm a cosmetic facial surgeon in Richmond, Virginia, and I do cosmetic facial surgery. So I only operate from here to here. I don't do boobs, bellies, and butts. Cosmetic surgery is my passion, and we're going to talk today about probably one of the most frequent questions I get from my patients or other patients, and because of YouTube and social media, I chat with patients all over the world and doctors. So this question always comes up. When can I exercise after cosmetic facial surgery? Okay? So I'm going to say this is a kind of a qualifier. Ask your surgeon. I'm going to tell you what I think and what I tell my patients, but again, you have to talk to your individual surgeon. So exercise is great. I think it's really good for you. And for the last 40 years, I've tried to exercise 5 or 6 times a week with resistance exercise and cardio. So I understand the affliction or the addiction of physical fitness. So exercise is a great thing. I think people that are in better shape, I think they heal quicker and do better. That along with surgical nutrition. So it's something we want our patients to do. However, the timing is so important because it can really be problematic. So let's break this down a little bit, okay? There are some procedures that I do, real small things where people can go to the gym that day, right? They can have Botox or fillers or have a mole removed or something like that. But for the surgical procedures, all right, it's very important to not increase your blood pressure, and you don't want to exercise. Now let's talk about these individual procedures. So how about eyelid surgery? So that'd be brow lift surgery, upper lids or lower lids. Anytime you operate on or about the eyes, bleeding is a horrible enemy. And if you bleed behind your eye, bad things can happen, including vision loss. Now that's extremely rare, okay? But the situation is for at least the first week after cosmetic blepharoplasty, I don't want my patients to do any bending, lifting, coughing, straining, anything that's going to increase their blood pressure, all right? So for the first 48 hours, I plead with them, please be a couch potato, all right? And one of the things that's frustrating for surgeons, and if there's other doctors watching, they know this, is a patient, and males are worse, they'll come in and they'll say, well, doc, I'm having my eyelids done, so I'm taking a week off of work. Man, I'm going to sheetrock my garage. And you're going like, oh, no, you're not. You're not going to do that. So people have a tendency, when they have time off, right, they're going to do all these things that they can't do because they're usually working or whatever. That's not good. You really have to focus your energy on relaxing and let Mother Nature help you heal. So for eyelid surgery, I need 48 hours as a couch potato, and I need really a week where you're not bending or lifting or doing anything. And after that, you can start back. I tell my patients, okay, so after the first week, start back at 50% with your lifting or your cardio and just increase it after that. And I've never had a problem with that regimen. Let's talk about facelift surgery, okay? Now this is a little bit of a different thing because there's a lot of sutures in there. I know what you're thinking. I look pretty good when I do that, so sooner or later I'm going to have one myself. But there's a lot of sutures in facelift surgery in various parts, in the neck, in the SMAS, in the jowl region, that are holding everything up temporarily. So what we do is we put these sutures in to tighten things, and I use dissolvable sutures because after everything heals, it's all scarred and stuck together, so you really don't need permanent sutures. However, for that first 4 to 6 weeks, everything is kind of held up by these sutures and held in place. So for facelift surgery, I tell my patients 30 days, and they can do anything they want, all right? You get a person that goes to the gym every day, and 30 days seems like 30 years. So they're not going to sit back for that. So here's, I think, a realistic situation. I say, okay, give me 2 weeks without any bending or lifting or stretching. And then we can start back, and I'll talk a little bit more about this. So for facelift surgery, when you have sutures that are suspending these different structures, the worst thing you can do is any like bending or excessive movements there that would be like golfing or tennis or bowling, yoga, doing various weightlifting situations, anything that's going to stress you don't want to do that, all right? So it's really important, especially in that first 2 weeks. So here's what I tell people. For 2 weeks, don't do anything. Actually, it's good for you. Let your tendons and your joints heal, because people that have been working out for decades, they're pretty sore anyhow, and that healing is helpful. Then at 2 weeks, I tell people they can start doing light cardio, okay? And this is for facelift surgery I'm talking about, and that would include stationary bike, walking briskly on a treadmill, not rowing, okay, because again, that's pulling on these sutures. So basically, or walking, they can go out in their neighborhood and walk around, and that's fine, all right, because you're really not stretching this stuff. So then at 2 weeks, they start back at 50%. On the third week, they can do a little bit more. By 1 month, I personally feel that most people are healed where they can just kind of get into their normal regimen. Now, I think you have to let pain be your guide. If you're doing something and it hurts, you're probably overdoing it, okay? So, and again, like at week 3, if they were going to do an exercise where they were sitting down and maybe doing light curls or something like that, again, where they're not just pulling on all this, it's probably appropriate. I have patients that are competitive athletes, and they do triathlons, and I have patients that are competitive bodybuilders or weightlifters, and they're throwing around hundreds of pounds. I mean, you don't want to do that at 2 or 3 or even in 4 weeks. So if you're really a big-time athlete, then you got to kind of look at that 6-week mark, okay? But I think it's good to try and kind of get back and do some things. I think it helps your recovery. But the biggest thing I think with cosmetic surgery is this. You really have to have your ducks in a row and your life in order. So a facelift, that's about a 2-week recovery from work. Most people are going to take about that time off. And if you try and rush a recovery and fit it in tightly, or you're really not serious about it, it's going to be hard on you. It's going to be hard on your surgeon and hard on their staff. You may do a facelift once in your life, or some of this surgery, or you may not do it again for a decade or so. So you really need to protect your investment and give it that time to heal. It's so important. So let's just kind of go over this one more time quickly. Eyelid surgery, give me a couple days on the couch with cool packs on your eyes and a full week of not doing any bending or lifting. For facelift surgery, give me that 2 weeks for sure of just kind of not doing anything other than the realm. I mean, some people can't even really drive until 2 weeks because it's sore for them to turn their head or their neck, and they're turning their body. Which, if you're on pain medicine and you really can't move, then you have no business being at a gym or driving a car anyhow. So after that first 2 weeks, I tell them they can start back at 50% with cardio stuff and progressively increase. So at a month, they can pretty much do what they want cardio-wise. And for weightlifting or any of the things I talked about where you're swinging or stretching, yoga, any of your sporting activities, you really need to give that a full month. So, and I don't want to bore you and talk about every single procedure that we do, but just in some other groups like cheek implants or chin implants, I tell people to really wait 10 days or 2 weeks and then start back at doing whatever they do 50% and just let pain be their guide. And by 3 weeks, I think most people can go back and doing what they normally do short of contact sports. For otoplasty, when we put ears back, all right, I don't really want patients to be in a a lake or underwater in a swimming pool, obviously they can shower and they can get it wet. They got to be very careful not to put a helmet on or anything that's going to bend the ears. And again, when you're talking about head and neck surgery, anything where you're bending over, you're getting more blood flow to the head. And that increased blood flow can cause more swelling, or it can cause bleeding or hematomas or seromas.
I want to add a little addendum here and talk about something else, because as I was discussing working out and surgery, it really occurred to me there's something else that's very important, and that is that to consider that gyms are really dirty places, okay? There is sweat and blood and contamination, and over a period of a year, thousands of people come in there with sweating and dirty hands, gloves, dirty sneakers, towels, socks, you name it. So they really can be bastions of bacteria that can lead to post-surgical infection. So again, these surfaces, even in the cleanest gyms, can be very contaminated with bacteria, and that includes staph and even MRSA, which is a pretty severe infection and can even be a flesh-eating type infection. So you really have to use your head, especially if you have open wounds, raw skin, recent incisions. So remember that these are risk for infection, especially in the early stages after surgery. So patients need to use care and common sense to make sure that you don't have contamination from these surfaces. So one of the things you can do is wash your clothes, and especially if you wear workout gloves frequently. And if you use boxing gloves or any common equipment at a gym, you need to be very careful, because other people are using and sweating in these. You want to avoid contact with any contaminated surface. So there are a lot of exercises or equipment that have pads where you lay your face during a exercise or workout or on a machine. And again, other people are sweating on this and they have bacteria, and it's just almost like a culture medium, just waiting to infect something. So you got to be careful. You want to wipe down your equipment before using it, and most contemporary gyms have equipment wipes, or you can carry your own Lysol wipes, that sort of thing. It's also great to carry with you during your workout a little bottle of the alcohol gel hand cleaner, and use that frequently when touching machines or ropes or just any type of surface that other people are touching. And you want to wash your hands and shower with antibacterial soap. So these are things that can be really important, because you spend all this money, you take all this recovery time, you go through healing. The last thing you want is an infection, and gyms are notorious places to get one.
So I hope that makes some sense. Again, every surgeon may have a different view of this. I love it when my patients exercise, because they're in better shape, and if you're in better shape, you're going to heal better. But you got to use your head and make sure you're doing the right thing at the right time, and let Mother Nature take its course, because if you have a quicker recovery and a better healing, you're going to have a better result. I'm Dr. Joe Niamtu, LoveThatFace.com.